Tennessee's governor unveiled his plan to fight the state's prescription drug and opioid crisis.
It's a public health and law enforcement emergency. The state says claims at least 3 lives a day. Governor Bill Haslam calls it TN Together. It's a $30 million legislative initiative he spelled out at a news conference this afternoon in Nashville. The plan calls for $25 million to pay for drug treatment for needy Tennesseans. The state acknowledged today there is a desperate need for more treatment options.
And TN Together also calls for more specialists in emergency rooms and more agent positions with the Tennessee Bureau of Investigation, as well as an increased supply of the overdose reversing drug called naloxone.
Our Tennessee Together plan will be comprised of 3 components: prevention, treatment, and law enforcement.
Governor Haslam in Nashville today. And tonight, Tennesseans continue to go through the plan. We have reaction from all sides.
Justin Soto joins us. Justin, what are you hearing tonight?
Well, I reached out to Mountain States Health Alliance, which long ago identified drug addiction as a major problem, as well as Sullivan County's DA, who's part of a lawsuit against drug companies. Both withheld comments for now while they looked through that plan. But tonight we do have reaction from one person who's passionate about the issue. She created an organization to help families of addicts called the Addicts Family, and she's a grieving mother from Bristol who hopes no one else has to live through the nightmare she's endured. For Rhonda Coffey,
I think he was about 3.
Looking through photos.
I just remember the significance of taking a family photo with my kids.
Especially of her son David, remind her.
We were so close.
But she says she was blindsided by her son's addiction to opioids.
He shattered his ankle and had to have an emergency surgery. And from that point on, it was all downhill. He started with the pain medicine from the hospital, and he was ordering OxyContin over the internet.
That eventually led to an overdose of meth and heroin.
It just spiraled.
A spiral that she's thrilled to see Governor Haslam working to address.
First, to address prevention, with reasonable exceptions, we will limit the supply and dosage of opioid prescriptions
through his new Tennessee Together plan announced Monday that includes a change in education.
For K-12, we will introduce revisions to the state's health education academic standards to increase education toward prevention.
Something Rhonda says is crucial.
Education from kindergarten up, that's going to be instrumental, and making sure that that's evidence-based education material.
Her reaction to the governor's plan to supply more law enforcement with Narcan.
Narcan for the state troopers, that should be in every law enforcement everywhere.
She's hopeful to see more resources in 2018 that her son didn't have.
He was so brave because every day he fought this disease without much help.
Republicans in Nashville applauded the governor's plan. From Democrats, though, criticism that the Tennessee Together plan doesn't go far enough. The chairman of the Democratic Party said any effort to deal with the opioid crisis should start with expanding Medicaid, something Republicans firmly oppose.